No one wants to talk about COVID on this holiday Monday, but for residents in long-term care, it is still very much a cause for concern. According to Public Health Ontario, those 80 and up have the highest case rates of any other age group, at a time when the frontline healthcare workers who care for them are burnt out.
The situation is quite alarming that in the middle of summer, we have about 30%, that's right, 30% of our long-term care homes in Ontario have a COVID outbreak.
The cases appear to be falling this week, but the situation was so dire last week that Renfrew County's District Health Unit put out this call for volunteers to help out at a long-term care home where staff and residents have been hit with a COVID outbreak. Dr. Amit Arya, who is a palliative care physician at a long-term care home in Toronto, says this wave is hitting the sector harder than any summer since COVID first began, at a time when frontline workers are burnt out and leaving.
Even on a good day, you might have one nurse, or you commonly have one nurse looking after 25 or 30 residents in the day, and that drops down to maybe 50 to 60 residents at night. So you can imagine when you have these multiple waves of COVID-19 sort of coming through the door once again in long-term care, if you lose that one nurse, it means that other nurses working on other nursing units are stretched even more. The suffering and neglect becomes worse, and frankly, this shouldn't be allowed to happen.
Just over 2 years ago, Premier Doug Ford called in the military to support long-term care homes that had been badly hit by COVID. Reports revealed horrific circumstances due to the lack of staff who had fallen ill. But low staffing was a problem long before COVID, and not just in Ontario.
Overall, Canada is grossly underfunding its elder care sector in the community, meaning long-term care and home care. So many other OECD countries, such as Denmark, the Nordic countries, put about 3% of their GDP towards, this basket of services, long-term care and home care. And Canada actually only puts about 1.5%.
The good news amidst all the bad is the COVID death rate for long-term care residents has plummeted due to vaccines. During Wave 1, before they were available, Public Health Ontario states the mortality rate in the homes was close to 32%. Today, during Wave 7, so far, it is 1.8%. However, Dr. Arya notes not all patients fully recover.
They survived COVID, but after COVID, they were left bedbound. Their appetite decreased by maybe 50% or even less. And sometimes they became permanently confused.
Dr. Arya wonders how many more waves the long-term care system and its residents can endure.
So I'm very worried that, unfortunately, at this time, because we're tired, we're normalizing these outbreaks in long-term care. And I'm absolutely scared, as are many of my colleagues who work in long-term care, about what we're going to see in the fall.
CityNews reached out to the Ministry of Long-Term Care to see if any other long-term care homes were struggling and needed assistance. So far, there has been no response.